If you've been neglecting your feet all winter, listen up. Spring is here and our toes are now on display. But if you're like 75% of Americans, you may be experiencing some type of problem with your feet, according to the American Podiatric Medical Association. Now, these changes usually can range from an ingrown toenail to foot fungus. Here to walk us through ways to prevent any further damage is podiatrist Dr. Krista Archer. Dr. Archer, thanks so much for joining us. So obviously no two feet are created alike, but you see a lot of the same types of problems, don't you?
Yeah, especially this time of year when everyone's excited to put their winter boots in the closet and put on flip-flops and ballet flats, take off their socks. Toes are aching.
Yes. So blisters everywhere?
Blisters everywhere, aching toes. Commonly see aching toes from ingrown toenails, hammer toes, blisters, bunions.
Those are painful.
Really painful.
Yeah.
Calluses and corns, very common. Ball of foot pain, very common, especially in women who like to wear high heels. Arch pain, heel pain.
Sounds like everything's going on
and
here.
there's skin issues too with the feet. You can't forget about the skin of your feet, which people often neglect their feet in the winter.
That's true. They've been covered all winter, and now you're exposing them to the sun. And while you're putting sunscreen on your face, you're probably not putting it on your feet, correct?
Yeah, forgetting.
Woo! So we're going to get to all of this stuff. And you brought some great new products that are out there for all this stuff.
So the bad thing about feet is there's lots of stuff that can go wrong. The good thing is there are lots of ways to help.
Great.
Okay, so there's over-the-counter, doctor-dispensed products here that people can use and try to relieve their pain.
And what is the most, if you had to point to one most common source of type of pain, what would that be?
Toes.
Toes.
Bunions and hammer toes.
And what do you have to deal with bunions and hammer toes?
Okay, so we have lots of pads over here. As you can see, there's gel pads for the toes, for bunions, protective silicone pads, as you see over there.
Fantastic.
Now, another thing with toes you don't want to forget are ingrown toenails, which are really, really common, especially now where people are getting more pedicures. A general rule is you want to cut your toe along the contour of the tip of the toe. You don't want to dig into the corners. You don't want a pedicurist to dig in the corners. And if you have an ingrown toenail that's red, inflamed, swollen, and painful, you want to go to a foot doctor, get it taken care of.
Is that an infection?
It is an infection.
It is, okay.
And the infection can get much worse if left untreated and spread up the toe.
Ooh, yeah. Wow, no, we don't want that.
No.
Now, what about balls of feet? You have some nice
balls
products.
of feet. Women especially have lots of problems with balls of feet. Over time, the fat pad thins. As we age, that's one part of the body where we lose fat.
Another downside.
So we're now using an injectable filler that we use for the face in the foot, called Sculptra, to replace lost volume. So that's one way to pad internally. Now we have lots of ways to pad externally. As you see, there's the foot pedals, little heart shapes to go in sandals really well. And here we have a gel pad. This one's really great because it has a hole here that you can go around the flip-flop.
Ah, so you can put this on the sole of your flip-flop and you can sneak your little toes around there and you can't even see it, and it gives you a nice little cushioning. Oh, I like that.
Yeah, and it's really cushy and the gel is really nice.
Oh, that is nice. Wow. What is this? Is silicone?
Yeah.
Wow.
Yeah.
So a lot of new products made out of this.
Yep.
Right. Now, what about the arches?
Okay. First of all, you should know your foot type.
Right.
Especially now that we're wearing ballet flats. If you have a low arch, you want to put something into the ballet flat because they offer no support to support your arch. So there's examples here. These are great, same kind of gel material by Dr. Scholl's arch support, and you just peel it and stick it into your ballet flat.
Oh, they look like they'd be so much more comfortable than just the flat sole.
Right, exactly. There's also other options here where it's a full-length padding, so it pads the ball, the heel, and a little arch padding here, and you can peel this off and it sticks in the shoe as well.
Fantastic. That looks great. Does that absorb a little sweat?
Yeah, that has a cloth cover.
That's another problem in the summer, right?
Yeah, we'll get to that too.
Yeah. Now, what about this? Is this the similar idea?
Okay, so we're moving on to skin now. Skin of the feet,
okay?
So first off, sunblock. There are great products that are spray. So it's like a 15-second thing.
Just do it.
Just to spray the toes and the tops of the feet. Remember, skin cancer, melanoma can happen just as any other part of your body on your feet. So you want to inspect your feet for new moles, freckles, changes of color or pattern in the moles.
And it doesn't matter how dark your natural skin is, correct?
Right.
I mean, you have a story about Bob Marley, correct?
Exactly. Bob Marley actually died of a form of malignant melanoma underneath his toenail. It's crazy. So the same thing when you're getting a pedicure and you're having your nail polish changed by someone else, you're reading a magazine, you want to take a look at what your bare nail looks like. Do you have fungus there? Do you have something that looks suspicious? Definitely get it checked out.
Now, as a podiatrist, do you do regular melanoma screenings for the feet?
As a podiatrist, I do check the feet for any new suspicious moles. And I have a new patient, I ask them if they had the mole for how long, is it new, and then I can refer out to a specialist if needed.
That's alarming because I don't think a lot of people are aware of that. So that's very, very good information. Now, these products here are for odor, for the sweaty feet that we get in the summer, right?
So sweat promotes bacteria. Bacteria promotes odor and also fungus, okay?
We don't want that.
That's another problem with toenails is fungus or onychomycosis. Again, women are getting a lot of pedicures. It's a contagious organism. And if you're not looking at your nail, then you're not aware.
So many things to think about before slipping on those ballet flats and flip-flops.
So there are some over-the-counter products for fungus, but you want to make sure that it's correcting the problem. If it's not, seek a doctor's advice and treatment. And there's also laser now for fungus.
Fantastic.
Which is a great option.
It's great to hear that there are so many options and treatments out there. Dr. Archer, thank you for all of that. And you can log on to the health page at abcnews.com for all the latest health news. We'll be right back.